Hello, my name is Ben Rossavik. Thank you so much for taking the time to listen to our presentation for this year's OSU-CHS Research Week. I'll be talking to you today about COVID-19's effect on inpatient emergency room evaluation of pediatric asthma patients in the first year of the pandemic. I'm currently attending with the Department of Pediatrics at OSU, but I worked on this research as a resident with a local attending physician, Dr. Weyman, who is an allergist with the St. Francis Health System at Warren Clinic. I've left my contact information here available for anyone who may have any further questions after this presentation. As for the background for this research, since the start of the COVID-19 pandemic, social distancing measures reduced person-to-person contact, which also limited common viral pathogen spread. As many of us know, asthma is a chronic lung disease, and upper respiratory viruses are a known trigger. Reduced asthma exacerbations were noted at our Children's Hospital at St. Francis during COVID-19, which prompted the study to assess how COVID-19 impacted these visits overall in comparison to the previous years by going through the medical records available through St. Francis. This study sought to assess the impact of the pandemic on asthma visits at our Children's Hospital within the first year of the pandemic. As for our method specifically, an IRB-approved retrospective chart review of pediatric patients was performed for individuals who were discharged from the hospital emergency room from our local tertiary center with a diagnosis including asthma, wheeze, or bronchospasm. Patient data was provided and compared as total numbers of annual visits, and the ranges were sorted in yearly increments from March 2014 to March 2021. We chose March specifically because March 2020 was when the COVID-19 pandemic was officially announced. The final year was compared against the trends that had developed in the previous years for patient encounters to see what degree of impact the COVID-19 pandemic had on overall asthma visits at our hospital. As you can see here, we put together a chart of the annual asthma visits at the Children's Hospital from the years 2014 to 2021, splitting those up in yearly increments. Interestingly, you can see from 2014 to 2015, there was the most recorded visits there. But again, this correlates to the actual diagnoses that were listed that included specifically the words asthma, wheeze, or bronchospasm. As you can see here with the general trend, at 2020 to 2021, there was a significant decrease from the previous years. As far as our total list, a list of 43,740 patients was generated for patients discharged from the hospital/emergency room for asthma diagnoses. Asthma visits were increasing since March 2016 prior to COVID-19. Total asthma hospitalizations and visits in 2020-21 correlated with an overall 40.5% decrease from the previous year alone. So for our conclusions, during the year after COVID-19 was declared a pandemic, our Children's Hospital experienced the lowest volume of asthma visits compared to the previous 6 years. Factors that may have contributed to this include social distancing and masking precautions, but also there is some thought that maybe some patients simply willingly avoided going to the hospital despite having symptoms. There is opportunity for further analysis in the years that follow to assess the impact COVID-19 has had on asthma exacerbations within our pediatric population. Thank you so much for your time, and we really hope you appreciated this presentation.